Good afternoon. I'm Scott Lamar, host and executive producer of Smart Talk on WITF, and I'm your moderator for today's Champions Summit. On behalf of United Way of the Capital Region, I'd like to thank our sponsors for making this event possible. Fulton Bank, Highmark Blue Shield, JPL, McNeese, Wallace & Nurick, Penn State Health, and Wegmans. Before we meet our panel, we have a special message from Governor Tom Wolf.
Hi, I'm Governor Tom Wolf. Welcome to the United Way of the Capital Region's Champions Summit. Today, you will hear from dynamic and dedicated community leaders who work in partnership with United Way to help families become self-sufficient through access to health care, basic needs services, school readiness, and workforce development. This work has never been more important than today because more and more people need help during the COVID-19 recovery phase. When the pandemic first hit our region, United Way went into action to connect people to help and raised more than $275,000 for local nonprofit organizations to provide basic needs services to our friends and our neighbors in need. Now, United Way is leading the way to help families get back on track. During these unprecedented times, it takes all of us working together, sharing our time and resources to improve life in our community. The challenges we face are not easy, but United Way never backs away from difficult issues. I know this because I've been a United Way supporter and champion for decades. I believe in the mission of the United Way and its focus on the most pressing issues facing our region. We know when a family is in need, it rarely is for one problem. Needing groceries to feed a family might mean someone in the family needs help finding a job. United Way gets this and brings together partners and resources to help individuals and families succeed and become contributing members of our community. United Way's work to improve lives through access to health care, basic needs services, school readiness, and workforce development directly aligns with my agenda to give residents of Pennsylvania a better future. I believe through our collective efforts, we will create a stronger, more vibrant community and Commonwealth. None of this work can be done by one organization or one individual. That's why we need you, our United Way champions, to share the message about United Way's work, give back through your time and resources, and encourage others to join you. 2020 has challenged our region and the entire Commonwealth in ways we never imagined. It's not the challenge, but how we respond to that challenge that defines us. I believe we have risen to the occasion and will emerge even stronger than before. And I'm grateful for United Way and all of you for stepping forward to be part of the solution. Thank you for your time, and thank you for living united. Enjoy today's summit.
Welcome back to today's Champions Summit. For those of you who are just joining us, I'm Scott Lamar, your host of today's event. We are here at JPL in a large studio, which allows us to socially distance. Eric Saunders from New Hope Ministries is joining us virtually. Now that we are at our seats, we can take our mask off and we can get started. This afternoon, we will discuss the unprecedented challenges facing the Capital Region and how United Way and its partners are working to help families get back on track. We want to hear from you today. Please submit your questions by clicking the link in the description area above this video viewing window. A separate window will open, allowing you to submit your question and continue watching the broadcast at the same time. We will try to answer as many questions as possible. Any questions not addressed will be answered and shared with you following the event. Let's start by meeting our panel members. I'd like to ask our panel members to introduce themselves and briefly tell us how they partner with United Way. Let's start with Eric Saunders.
Well, good morning in my time zone. Good afternoon to all of you guys. I'm the executive director for New Hope Ministries, and we are a nonprofit social service agency that helps with food, basic needs, employment, and youth needs. And we've been a United Way partner for probably about a decade.
Okay, let's go move with our panel here in the studio. Tim, let's start with you.
Hi, I'm Tim Fatzinger. I'm the president and CEO of United Way of the Capital Region, and I'll get a chance to chat with you a little later then.
Good afternoon. I'm Jeannine Peterson, CEO of Hamilton Health Center. We are the lead agency for the Access to Care initiative.
Hi, I'm Joe Arthur, the Executive Director at the Central Pennsylvania Food Bank, based here in Harrisburg, Pennsylvania, and a proud United Way partner.
Good afternoon. I'm Dayl Lynn Shadock. I'm a principal at Sporting Hill Elementary School in the Cumberland Valley School District, and I work with the United Way in that we have Ready for School at our school.
Well, thank you to our panel members, and I encourage all our panel members to participate in the conversation, even if there's a question that is directed specifically for you. Our first question is for all panel members. What changes have you seen in demand for services since the COVID-19 pandemic hit our region? Tim, let's start with you.
Well, from our United Way perspective, Scott, I think the first thing we really had to think about was connecting people that needed help right away. Many of you might be aware or not aware that we have a service called 211. If you need food, clothing, shelter, assistance, somebody simply could dial that, and you can text to it, you can find it on the web, and it works on all phones across the state of Pennsylvania, in fact, across our nation. Secondly, we really knew resources were going to be needed to help people, so we really went into fundraising mode. As Scott mentioned a little bit ago, we created a basic needs fund, and then we also partnered with our friends from the Foundation for Enhancing Communities, in which we were able to raise additional dollars at a regional level too. So these were the kind of the immediate things that took in place, was connecting people in need and starting to really look at resources to help those organizations that could help people immediately.
Jeannine, how's your organization reorganized?
Well, as an essential organization, we've been open since the beginning of the pandemic. And we have also, in that, found that individuals weren't coming out for health care. Hamilton Health Center is a federally qualified health center providing medical, dental, behavioral, vision services, and social services to the capital region. And when the mandate to stay at home came about, a lot of individuals were staying home, not coming to their appointments. So we had to quickly pivot to telehealth visits. We also had to screen everyone coming into the center. So it's been quite a transition for us, trying to keep up with the changes of staying at home and now being green and allowed to come in. We're continuing to screen everyone, and people are now coming back for appointments.
Joe Arthur, how have you reorganized?
Well, Scott, we've really had to adapt. We were declared life-sustaining by the governor early in March, which allowed us to serve, but we had to learn how to serve quickly in a safe way and also serve many more people. Prior to COVID, we were serving about 135,000 individuals each month. Now that's up around 200,000 people. And to do it safely and socially distanced, we actually had to close our volunteer operations at our hub and open those at a much larger facility off-site so that we can spread out and really do this work safely. One thing I'd like to point out is the community's been so generous. We've needed a lot more in the way of donations of money, as well as food, and folks have really stepped up, both within United Way and from the general public as well.
Dayl, education is one of those things that we may not know yet all the changes that will occur, but from what you've seen so far, what you've experienced so far, what about reorganization?
So we, again, it's making those connections with family. That's so important to us. And with the school readiness program, we really have to push ourselves, put ourselves out there. So our educational liaison ended up doing a lot of Facebook type of activities for not only educating families, but for helping kids as they grow and develop. And then we did a drive-through pickup at our school for the kids to pick up their materials, because we thought we were going to be out for 2 weeks, and we haven't seen the kids since March 13th. So she did a drive-through for our preschoolers where they could come through and get supplies. So those supplies are things that they could use as she was doing virtual lessons on Facebook.
Eric, what about reorganization for your organization?
It's been quite a busy couple of months for us. At first, when we saw businesses shut down and paychecks, stop, and a lot of folks weren't seeing their unemployment yet, we had a huge increase in demand for food. And so it was all hands on deck, socially distancing, trying to get food to people, either curbside or home delivery. And just a huge increase in demand, seeing people who had never had to access a food pantry before, and trying to meet those needs. But then we began seeing people who were falling behind on rent. And that has been one of the biggest areas of increase for us is emergency housing needs. Even though there's some eviction moratoriums and foreclosure moratoriums in place, it doesn't mean that folks aren't falling behind on rent. And so we've got this looming eviction crisis. And then because of our focus on workforce employment, there's a lot of people who are off work. Not everybody qualifies for those extended unemployment benefits. And that puts people in a new financially vulnerable situation, and trying to deliver workforce services while socially distancing and employers not ready to bring people back to work. It's just been one of the most challenging situations I've faced in my social work career.
A few of you touched on increased demand when we were talking about reorganization, but I wanted to talk about increased demand specifically. Joe Arthur, let's start with you. Eric just mentioned the demand for food. Very early on, I remember talking to you about just what Eric had said. So many people that had never been food insecure, but lost their jobs, lost their paychecks. Talk about that increased demand for your services.
Yeah, for us to go up 40 and 50% in very short notice really told us that a lot of people were struggling quickly. So when it was necessary to shut down a lot of employers, or at least their places of business, we immediately saw people coming to us whose paychecks had stopped, as Eric had described. And our job is to really make sure there was enough food, enough healthy food to serve all of the families, all of the individuals in need. And it was a challenge early on, because if we remember back then in March, April, grocery stores were really being overrun. People were buying everything out of the grocery stores, including the common foods that we put in our food boxes. And it was a real struggle. So we worked with our grocery friends like Giant Foods, Wise Markets, and others, and just really reached out to our big suppliers, used the contributed funds we were receiving from donors to just buy as much food as we could every single day. And it was a challenge. It even remains a bit of a challenge today, but things have stabilized. And we also relied on our partners with the USDA, as well as the State Department of Agriculture, amazing people that were finding ways to take the disrupted supply chains and turn those into sources of food for us. So restaurant food that wasn't being used because restaurants were closing, they were repackaging, providing it to us so we can provide it to families in healthy boxes. So, and really a hats off to our partners like New Hope Ministries and our hundreds of other partner organizations who found a way to stay open, stay safe, and serve people in a socially distanced way with curbside service and other innovations. All of that happened within a couple of weeks, way back in March. So we didn't plan it, but we all adjusted and adapted, so to the benefit of people that were struggling.
Joe, I ask you this question almost every time I see you, but Eric touched on this as well, that there are so many people out there that have never had to seek food, and probably some who still are hesitant to do it because they don't want to admit that they don't have a paycheck coming in, or this is something we can handle ourselves. Do you think that there are more people out there that are food insecure that you're just not seeing?
I actually do, and I think one big help has been the federal and state resources that have flowed into many families, whether it's for rent or however they're using that, and I think that's helped some folks temporarily stabilize. But a stigma is an issue, and people, it's not easy to ask for help. We always encourage people, particularly during a crisis like this, which is a time like no other, if you need help, reach out for help. Don't put your family at risk. And we say that moving forward too, because we're very concerned as we move forward in time that folks are actually going to need perhaps more help than they have over the past couple of months. So we do think it's a challenge. We do a lot of outreach work. Our friends at 211, as Tim described, we're the #1 food assistance referral from 211. Make that phone call. Call 211, go to our website. However you get to us, please do it. We have the food. We just need you to call us.
Eric, off to the side, I see you nodding as Joe is talking. You've experienced the same thing?
Absolutely. You know, it's interesting as some of the public supports kicked in. We saw, and many of my colleagues who run food pantries around the region saw a drop in need through May, June, and we're starting to see a climb in needs. So I'll be eager to look back, you know, get the data for 6 months and try to figure out why we saw an up and then a down and then an up again. But we're seeing different types of needs. We're seeing new families in need. And I don't think we're out of this yet. I think people are exhausting their resources, and there's a moment coming where unless we see a vaccine or we see a real slowdown in virus, that there's going to be a lot more folks in need, and it's important for our nonprofit community, you know, United Way partners, to be prepared for what happens next. And I don't want to be a doomsayer, but you know, being prepared helped us weather the first part of this crisis, but continuing to stay prepared, I think, sets us up for whatever happens next.
Jeannine, you said that you actually have seen fewer clients at Hamilton Health Center. Is that because they were afraid to come in and possibly pick up contract the COVID-19 virus? Or what do you attribute that to?
Yes, so in the very beginning of the pandemic, we saw fewer patients coming in because of a fear of contracting the disease. That caused us to pivot to the providing services through a telehealth mechanism and addressing their needs that way. Where we saw the biggest demand was in our social services and our behavioral health services, because as you've heard so far from the panelists, there's a significant need for basic needs of individuals. So whether it's about the education or food or housing, our community health workers are out there. That's a part of the United Way's Access to Care initiative. They're making calls. They're reaching out to the population who had been fearful so that they could let them know about the resources that are available.
I want to move on to our next question. In your model of work, how do you foresee your organizations operating in crisis mode? Or how long do you foresee staying in crisis mode? And Dayl, I'm going to start with you.
So I guess we'll be operating in crisis mode until there's a vaccine. We don't know. There's just still a lot of unanswered questions in education, so we don't know where we're going or how long this is going to be. But right now, I foresee next year to be a sweet year.
Why do you say that?
Because I think next year we'll be back to normal as far as having all of our kids in our school and being able to run programs like Ready for School within our schools again, because right now we can't run those within our schools.
But do you see some of the things that have happened as a result of COVID-19 being permanent in schools?
Yes. Yes, there's items that will be permanent, but I don't think it's going to be bad. Meaning, like, we're changing procedures. We're changing some ways that we do things within education, as far as basic as parent pick up and parent drop off. We're changing those, and we're really monitoring more of the people that come in, and really making sure that the kids are healthy when they come in. We want to work with the parents. We want them taking the temperatures of the kids before they come into school. So I think things that are changing are going to be positive. It's still way off in the future.
Tim, I don't know if the United Way is ever in crisis mode, but you do see it. You see the results when there are many people more than usual in crisis situations. How long do you see this lasting?
Well, it's our biggest concerns in this model is what we're going through right now is there's no you have to go back to the early 1900s to see something like this. We look back to 2000, 2007, 2008, and when we had the recession, and it took us probably 6-7 years to get back fiscally where we were and service provision from what happened in that recession. Our greatest concern right now is, you're sitting at unemployment rates in Dauphin County, I think around 12-13%, and Cumberland around 9%, and we know Perry's similar. We know that the path for self-sufficiency is somebody having a living wage and earning an income. So our biggest concern is how long will it take for the economy to come back where these jobs get filled again and we're at those historically low unemployment rates. Because when somebody isn't working, there's only so many subsidies that are available to them, and we as a service system have to pick up those areas when those subsidies run out for folks to be able to do that to get people back on their feet. So our biggest concern really is how long does it take for that economy to come back in that time frame, because that has an impact on all of our areas, from basic needs to health, education effects. I mean, there is a direct correlation between the economics of a family and how well off they are in those basic needs in life. So that's...
Tim, before anyone ever heard of COVID-19, the United Way talked about ALICE. And basically what that was is a lot of people who just couldn't afford the basics, like food, like paying for their heat, transportation, that kind of thing. From all indications and from what you just described, this pandemic has exacerbated that whole much more. I mean, let me put it this way, have many more people fallen into that ALICE category because of the pandemic? And I mean, you could see people that have made a good living who lost their jobs who may not be able to afford those basics.
Yeah, so that term ALICE really is that asset limited income constrained employee. Those are folks that had jobs, and they might have been on that edge before being able to afford their basic needs. Disproportionately, the people that have lost their jobs in retail and hospitality, the restaurant areas, were those folks that were on that edge before already, and they're the ones that have been directly affected by that. So that's our largest concern, is that was already a vulnerable population, and now they're the ones that have been impacted most by the pandemic and the results from that. And the question is, for the recovery purposes, how long will it take for those industries to come back and to help those folks move forward in those areas? So that's our biggest concern right now. That is disproportionately affected really those low-income families.
Eric, I'll ask you the same question that I asked the other panelist about how long do you see this going on, especially with what Tim just said about the time of recovery, not just months, but years?
I think that there's the healthcare question, and I'm not qualified to give an answer. I'm hoping that by the end of the year, by the spring, that we're going to see at least some limited vaccines available that may help control the spread of virus. The number that is giving me the greatest cause for concern right now is that for those people who have lost employment, who have been laid off because of coronavirus, that up to 40% of those jobs may not come back. And that's going to be devastating for the economy. Just a few short months ago, we could find anybody a job who had basic, qualifications. And we could find good paying jobs with a little bit of training and a lot of encouragement and support. My big question then is, well, I know that there's likely to be some healthcare jobs. I'm likely to be some manufacturing jobs. But what about the service sector jobs? Have they gone away? Are they going to, or do we have a big group of people who are going to be need job training, retraining to be able to enter a different sector of the workforce? I'm optimistic. I think we've got great programs. We've spent years working on these problems, and it's not like we have to start from ground zero. We can jump right in, helping people find employment. We've learned a lot about social distancing and keeping ourselves safe over the last couple months. I think it's a new normal, but for a lot of people, my hope is that maybe they come out of this crisis doing better economically because of the investment in families and those who are financially struggling.
There are those who see this as an opportunity. Maybe we can talk about that a little bit later. But first, I want to take some questions from some of our viewers. Due to people who may be unable to get out and socialize, such as elderly or handicapped, how do the panel members assisting in making sure that those people are being taken care of? Tim, let me start with you.
So I think transportation and access to services. We're fortunate in central Pennsylvania to have robust services. We have very good health services. We have very generous people, but our issue has always been access to those services, information, and trust of those services. So you add a pandemic to it that makes it more difficult. But what I do think is, and I think Jeannine and Joe could talk about how they've transitioned some of their services really to bring them to the people in need at this time frame. And I think that's the creativity. That's where extra funding has helped and extra resources have helped them be able to pivot the work that they've been doing to bring it to people most in need right now. So I really like to kind of shoot to those guys because I think they're doing some very creative work around how they can distribute services at a remote level.
Mm-hmm. Jeannine, you'd like to weigh in on that?
Sure. So I spoke previously about telehealth services, and that enables a doctor to actually make an appointment with their patient using the telephone or a video capability. And they are able then to address that particular problem. They can also call in a prescription. That prescription can be delivered to the home. If that patient has not been in, that's where there is somewhat of a challenge. But there is free transportation available to get people to and from an appointment. Our community health workers, which is part of the Access to Care initiative, we call it Contact to Care, they can connect those individuals to a transportation opportunity and get them to and from the appointment. They can also, if it's a dental appointment, they can also get that person to a dental appointment. Individuals that are going through a crisis, they've lost their job, they're trying to navigate, they don't know what's going to happen with their children. All of these things become paramount in their lives, and so trying to navigate a complex healthcare system can really be problematic. So our community health workers have been essential in helping to make that an ease for an individual that needs to access any type of health care, not just at Hamilton Health Center, but in anywhere that they need to go.
You know, there are a group of people that, and this is just not a monolithic group, but I guess several groups of people that I think of during this crisis who have been isolated, who haven't had access or haven't sought access to the help that they need. And by that, I'm thinking of those who may be suffering from mental illness. I'm thinking of those who may be in a situation where there's domestic violence or child abuse. We know that the state has reported far fewer reports of child abuse during this. Part of that is because children haven't been in schools, and so often teachers and counselors are the ones who report child abuse. Mm-hmm. Those people who have been isolated, what help is available to them now what help is available to them going forward. Eric, let me start with you.
Well, we've mentioned 211 several times, and I think it's important to bring that up and to remember that you can call and find support for whatever needs you're facing and get directed to the best source of help. We have done a lot of phone contacts of just calling people and checking on them, saying, how are you doing right now, especially our elderly population. And they, many times we've been told, you're the first person I've talked to in a long time. We've shifted to doing home deliveries and curbside pickups and mobile, kept our mobile food pantries going. So trying to take services to where people are. And it's been interesting trying to be innovative and come up with new solutions. So I'm joining you by Zoom today. We've been doing Zoom budget classes and GED instruction. And so, just because it's hard doesn't mean that you can't find creative ways to get around the problem. But I think that personal connection of knowing that there's somebody out there who will do what they can to help you is really important for those who are struggling. And we just hear over and over and over how grateful people are for any help that they're able to receive. I haven't had anybody complain about, not getting the type of food they wanted in their food box. They're just glad to have somebody checking up on them.
Dayl, I mentioned child abuse and school. What do you anticipate as far as that area when kids do come back to school and their teachers see them, their counselors see them? I mean, a lot of them have been stuck in the house with parents or maybe other adults since March.
Mm-hmm. Yeah. What I've been thinking about is just what a great organization this is, because we're here helping right now in this crisis. United Way was here helping before the crisis, and we're still going to be there after the crisis. And I can see, right now we're helping our families, we're helping people medical or food needs, but when our kids get back into school, United Way is going to be there helping us too, to get them ready to, the resources are still going to be there. And more than ever, I think we're going to really need to build those school readiness skills. And this organization is there the whole time, helping along the way, helping our families, helping our community. And it's just an honor to be part of it.
We have a question from one of our viewers. A tsunami of evictions is waiting to happen when government-imposed restrictions are lifted. Many families in central Pennsylvania will be forced out of their homes. What can United Way of the Capital Region and panel members do to help these families in transition? Tim, I'll ask that of you.
Yeah, we were actually discussing this, Scott, at lunch today about concern. There is dollars and there's rules around right now before why evictions can't take place. Now, this is where resources come into play. I always tell people, they ask me, Tim, how can you ask people for money over and over? And I always say, I'm not asking for myself, I'm asking for people in need. When these subsidies stop, we are going to see the need around rent assistance and utility assistance in those areas. And that's really where those extra dollars come into play to help those individuals make sure they can keep their home so that they can get back to work, so they can work on their health, so they can go to school. Our goal is always to move people to self-sufficiency. But there's these bumps, and this is a big bump in the road with the pandemic, is that how can we get people back to so they are employable again and that they can afford to pay for these themselves? And this is where resources come into play. And then we work with great partners, like New Hope and the Food Bank and other areas to help make sure that they can provide that rent assistance when it's needed, to pay for those utilities. It's not for permanent times, because our goal is to get these people employed again or re-employed again and back to work so they can afford them themselves and pay for themselves. But can we do that in the short term? This is really where we need those resources, and that's where your dollars as a donor and organizations help in this time frames to get people past that hump, to get people past those efforts to be able to do that. So it's, people think of money when they think about United Way, and we do so much more than that, but this is one of those cases where those connections are vitally important for us and where your resources are highly valuable to make sure that we can get people over that situation so they can go back to paying for these items themselves.
Joe, Central Pennsylvania Food Bank may be in a unique position to see what's going on when we're talking about evictions and people losing their homes, because there probably are people out there, I'm sure there are, and you may have heard these stories, of people who are having to decide between putting food on the table, paying their rent, paying their mortgage, paying their utilities. Have you heard stories like that?
Yeah, we actually hear stories like that every single day, and so do our partners. And you can look at food assistance also as one of those supports that saves a family money. So if we're able to provide healthy food when they need it, as much as they need it, and that is our job to do that, then that saves them however many dollars, perhaps $400, $500 in a month, that can then go to pay for those expenses that aren't going to give. So once the housing and rent moratoriums are ended, all of a sudden all that rent is due. You have to either pay that rent or you're not going to have a home. It's as simple as that. So as Tim described that, we're all trying to come up with solutions together to make sure that doesn't happen. And one of those solutions is helping take care of the other expenses. Eric talked about utilities, helping with other needs. At the food bank, we're providing food assistance, and that's going to save folks money and hopefully help them tend to their other expenses. And the other aspect of that that's important is that it needs to be healthy food. So we've been focusing on healthy food at the food bank, making sure that when we provide that food to our partners like New Hope Ministries, they're able to provide shelf-stable food that you want to put on your table, fresh produce, frozen meats, dairy products, eggs, all of the great foods that we all like to go to the grocery store, so that during that time of need, their health is not suffering from a lack of nutrition.
We have a question from a listener, and this is directed to you, Mrs. Shadock. Can you speak to how Cumberland Valley and other school districts are assisting families with preparing to learn remotely? How are children in need of food helped when learning remotely?
So when we first went remote, it was quick. And we were able to give devices out to families that needed it, but we also served lunches. And so people drove through at 5 different locations in Cumberland Valley and were able to get, they drove through 2 days, they were able to get 5 lunches, and then we started giving out breakfast too. When we start school up again, that's going to continue. So kids who are whose parents choose to do remote learning are going to have the opportunity to come in and get their lunches and breakfast for free if they qualify for free and reduced lunch. So we're still going to be doing that outreach, and then we're also a lot of training with the kids and with the parents to teach them the best way to learn virtually. But we will have that asynchronous, that's our videos already created, and synchronous time where the teacher is actually teaching via Zoom going on in the course of a day, teaching math, teaching ELA, and social studies every day. So it's going to be a lot more rigorous than it was in the spring.
Joe Arthur, what about children and food?
Yeah, it's been a real challenge during the summer this year. Fortunately, some of our partners in schools have worked with us to allow us to provide boxes of healthy food for the entire family. Normally, summer feeding looks like kids in a park or at a school site receiving lunches just for the kids that they would eat there at the picnic tables or whatever the setup is. But this year, we needed to serve those children and their families in that venue. So it wasn't able to happen everywhere in every single community. And that wasn't for lack of food. It was really for the difficulties of coordinating that from, a school perspective. But this year, we doubled the amount of food that's gone through our youth programs that handle that work. So we're proud that we were able to to help thousands more families this year relative to last year. But again, it's important that food has to be healthy. So we once again have to thank all of our big food donor companies and our donors in general and our United Way donors. None of that would have been possible without their support. So we need to thank them and our volunteers that actually pack those boxes.
Thanks, Joe. Now, we're going to take a brief break and go to Tyne Stock from United Way's Coordinator Council for the announcement of the 2019 Best of Award winners for outstanding campaigns.
Good afternoon. I'm Tyne Stock from Miller's Mutual Group, and I'm pleased to serve on the United Way's Coordinator Council. Today, I will be announcing our 2019 Best of Award winners. All nominees were announced at the United Way celebration in February. Every year, the United Way of the Capital Region recognizes the outstanding work of our local campaigns for leadership of their campaign and campaign teams, as they are the boots on the ground and they are what make the campaign happen. We could not do our work without their amazing efforts. The winner of the Best of Award for an outstanding campaign team of a small company is Pennsylvania Chamber of Business and Industry. Congratulations. Moving on to medium-sized company, the winner of the Best of Award is Hersha Group. Great job. Finally, the winner of the Best Award for large-sized company is PA Health and Wellness. Moving on to Best Video category, I am pleased to announce the winner of the Best of Award is Deloitte Consulting. And finally, the Best Event category, the winner is PA Media Group. Congratulations to all of our winners for your amazing work. And now back to Scott and our Champion Summit.
Thank you, Tyne, and congratulations to all the winners. Now, getting back to our conversation with our panelists, Jeannine, I wanted to ask you about Hamilton Health Center and testing. We know that one of the reasons that it has been so difficult to get a handle on COVID-19 is because of the lack of testing, just not enough testing. Are you testing at Hamilton? And I guess the question I have to ask is, how costly is that?
So the short answer is yes, we are testing. About 3 weeks ago, we launched our community testing initiative, and that is a mobile unit that we're able to travel throughout the capital region to get to communities that are at risk for COVID, especially those at high risk of COVID. As we know, our hospital systems have done a phenomenal job in providing testing in, I'll call it the peripheral of the city. UPMC Pinnacle, Geisinger Holy Spirit, and Hershey have testing available. However, there is no testing right in the city, or if we look at Perry County or Northern Dauphin County. And so our testing initiative is really targeting those areas. We started, as I indicated, about 3 weeks ago. We will have our next testing event on the 15th, which is Saturday. It's a drive-up or walk-up, no appointments needed. And it's a self-swab test. The uniqueness of this testing initiative is that when the results come back, we contact both the negatives and the positives. And those who are positive, as everyone knows, have to quarantine for 14 days. Well, there are many families, when you say 14 days, they don't have the food available to them to be able to stay at home and keep themselves safe. So in partnership with the United Way, our community health workers are actually going to provide food for those who are food insecure. So they will make a contact to those who were identified as being positive. They will ask them if there is a food insecurity in the home, and if so, they will actually deliver a food box, which is a result of a partnership with the Pennsylvania Food Bank, and they are providing those food boxes for individuals. So we see the collective impact in motion in this particular initiative. So we will be getting our testing off the ground up in Newport on the 29th of this month, and then we will have regular testing days throughout the city and in the highly impacted areas.
How costly are those tests?
So we are very fortunate that the tests themselves are at no charge to an individual. If an individual has insurance, the insurance company is charged for the cost of the test. If it is an uninsured individual, the test is charged to the CARES Act. So we're really pleased that an individual does not have any out-of-pocket expenses to be tested, and that's very important.
Let's take another question from a viewer. Listening to the panel on things available to people in need, I had someone state to me that she worked a full and part-time job to stay afloat. She's lost her second job and is becoming lost for help. She's not in poverty, but in the middle and doesn't know where to go. I mean, this sounds like Alice, but at the same time, it's kind of a unique situation. Tim, what kind of advice?
Well, I think depending on what your situation is, we've overused the number, and hopefully we'll continue to overuse the number. For immediate assistance, that 211 number they can truly help you connect you and your family to services that are needed. For long-term purposes, about it is we have, with Eric's group, they have case managers, we have health workers with Jeannine's, and then, with our school readiness, we have education liaisons, and all of these individuals have been trained to help families walk through complex problems and issues. So, each of those different initiatives and help that they can provide, and their goal is we know it's not a single issue that exists in a family. It's not just food. It's a combination of issues that come along with that. So my suggestion to you is to first, where immediate needs need to be met, is that 211 number can help those. For long-term, think about prognosis, where you need to be, and if it's changing professions, if it's working, if it's training, then it's part of our workforce initiative. If it's health issues, then it's really our health initiative. If it's really working on education and getting kids in school it's really those areas. But I would truly start with that 211 number for those immediate assistance, and then we can help you with that long-term efforts, depending upon what direction you want to go, and help kind of create those plans for you.
Eric, do enough people know about 211? And this kind of gets back to the question we asked earlier about people seeking food assistance. People who have never been in this situation may be the least knowledgeable about how to actually get help. Do they know about 211? What do they do?
I don't think that the 211 system is well known, or people think about that there could be resources available to help with your particular area of need. I mean, they've got great emotional support. They've got great knowledge of community resources. Being part of the faith-based sector, we're connected with hundreds of local churches. And so they know to call our agency. If you're in Harrisburg, you might know to call the Salvation Army or another United Way partner if you know that somebody's in need. And the nice thing about a really robust social service sector is that we can refer people back to 211 if we aren't the appropriate agency to meet their need. We can suggest other resources. Whether it's stigma, whether it's lack of knowledge, it's most important right now, I think, to realize that nobody's alone, and that there are places where people are going to care about you, not judge you, probably who have been in the same situation that you've been at some point in their life, and are just happy and delighted to give back and to see your life improved.
Mm-hmm. This is a question I wanted to ask a little bit earlier. We know then that when a crisis like COVID-19 hits a community, it rarely causes only one problem. Now, all of you have touched on some of the other problems, but how connected are you to the issues that you're seeing? And Eric, I'm going to start with you. How connected are you to some of these other issues, and what are some of the other issues that you're seeing?
Well, for an agency like New Hope Ministries, we serve suburban communities, we serve small urban areas like Mechanicsburg, and we serve a lot of rural communities as well. And what that means is that there's generally a dearth of other human service opportunities. So we've become generalists and had to cover multiple sectors. So when you come to our door, you can get help with food, you can get help with housing, you can get help with utilities, you can get help finding a job, you can get help with budgeting skills or education, or and so if we don't have a service for the particular need, we generally know where to send somebody to try to find help with that service. And being a United Way partner agency is incredible because it's usually my fellow United Way partners who are my go-to services. But there's such an interrelatedness between the different needs that people are facing right now. Hunger looks like housing insecurity, looks like unemployment, looks like need for emotional support. And it's important to touch multiple areas when you try to help a family who's going through a tough time. And there's a lot of people right now going through tough times.
Mm-hmm. Dayl, I'm going to just go right down our line of panelists here. An issue that you maybe didn't expect, an issue that you're seeing as a result of COVID-19?
I don't think we're seeing it yet because our kids haven't got in, but we know that we're going to have a lot of teaching and support of social and emotional learning. We're just going to have to really focus on the trauma that the kids have been through this time and refocus, if you will, putting that on top, and the academics come next. Because if we don't have them socially, emotionally stable, the academics aren't going to come.
Will there be more counselors in schools?
Right now, no. There's less kids in school because
Right.
I think it's about 40% of our elementary students are going to be online. So we'll have less students, so the counselor will be supporting less students.
You know, something that many people may not realize is that not all Pennsylvania schools have counselors.
Yes.
Not all Pennsylvania schools have school nurses. And even though there may be fewer students in the classroom physically, there may not be people in the buildings that can offer the kind of support that you're talking about. Mm-hmm. Or will that change as a result of this?
That's a good question. I mean, I don't know if that's going to change, but I know at my school and within our district, the focus is going to change. So teachers are the educators, they want to learn this stuff because they also know that if we don't have a handle on how the kids are feeling emotionally, they can't move forward with the academics. So that's where our professional development is focusing on this next year, and that's the teachers have been doing a lot of training over the summer, and a lot of what they're doing is based on the trainings they're doing is based on trauma and social emotional learning.
Joe, an issue that maybe was unexpected that has popped up that you didn't expect?
Yeah, Scott, I think the very biggest surprise for us was actually that in our food systems, there were vulnerabilities that we hadn't really thought about. So if we think about food service, whether it be restaurants or big venues, when they started to close, all of the food that normally goes there backed up and orders were canceled. And so from farm to family, that disruption really became evident. And those are things that we have to work on as in the American system. We have the best food systems in the world, but there are choke points that are now being worked on that we need to improve so that there isn't this loss of great amounts of food and income to our farmers and other producers. That really surprised us. I think we've learned pretty quickly to adapt to that as far as a food bank is concerned, but a lot of people were really harmed. A lot of people lost their incomes simply because our food systems were vulnerable at different points, and we do need to address that both at the federal level, the state level, and then within our commercial entities. That was a big surprise to us, and it created a lot of challenges.
Jeannine, any surprises?
So we actually didn't expect this pandemic to last as long as it has. And now we're faced with employees who are single moms who don't know how to address the school situation. How's that going to impact the workforce? Because some parents are going to be forced to make a decision. Do I go to work? Do I have to stay home, especially when you have young children? The other thing that we're faced with now going into the fall is that we're going to be getting into flu season. And so the symptoms of flu is the same as the symptoms for COVID. So we are really gearing up for flu clinics, encouraging people to get that flu shot, trying to also prepare and hopefully get better testing out so the results can come back. That's the other surprise, is how long it's taking to get the results of tests back. So we're hoping that we'll have a more of a rapid test so that those results can come back early, rule out flu, and then you can test for COVID. So those are some of the things that we are still surprised about and are hoping that by fall we'll have some of this sorted out.
How long is it taking to get test results back?
So as we're testing, we're telling people 7 to 10 days. We've been pleasantly surprised recently that some are coming back within 5. If someone shows up and is symptomatic, we're able to get a result back within 24 to 48 hours.
Question from one of our viewers. During times like this, how important is collaboration between organizations, business, and community partners? Tim, I think you're in a good position to answer this one.
Yeah, so I think that one of the things I love about United Way is this collective model where there's a few organizations in the community that can bring together government, for-profits, nonprofits, ministeriums, and bring them together to solve very complex issues. And this is kind of the landing ground where I think United Way has its ability to convene around very complex issues and try to figure out these solutions. And I think Jeannine and Joe, we've highlighted how we get those and make these efforts work together. So I think that is unbelievably valuable right now. There's other organizations. You have the chambers that are working on it. You have community foundations that are working on it too. But I think you need those trusted places where our sole goals of organizations like those and like United Way are really to bring folks together to look at these very complex problems, because there's a lot of people out there that want to help. There's a lot of organizations that want to help, but they know one piece of the pie, not the whole picture. And when you get them together, we can figure out what that whole picture looks like. So more than ever, we're seeing more and more collaboration. We're encouraging it, and to really solve these very complex issues. So this is an area that we're really excited about, and I think that we'll see more and more of that happen in the future.
Tim, I'm going to have you address this one as well, but any of our other panelists would like to weigh in. Since volunteering in person is not really an option at this time, and maybe it is, it isn't, maybe you can talk about that. Are there other ways that companies and their employees can help to give back to the community other than monetary contributions, Tim?
Yeah, I think, in fact, a little teaser, which we'll end this with, is we have some opportunities coming up. So one of our greatest challenges is that we leverage volunteers to do work for us, and they're an incredible workforce for us and helping people connect and get back. But there are virtual ways that we're able to do that. And there's also safe ways to volunteer, too, under CDC regulations, too. But a good example is we know school supplies are going to be needed along with health supplies, and there's ways that people can do drop-offs and help purchase online so that we can distribute those supplies to areas where they might have done a collection in person before. There's other areas where, and Joe can speak to it too, like the food banks created safe opportunities of safe distancing where they can actually volunteer successfully in those types of efforts too. And then there's areas that you talked about need before, that things we didn't think about that surprised us. Things like there was a blood shortage, for which I still think exists, and you can safely give blood right now, and there's safe ways to do that and mobile ways that can be done. So those are kind of those gaps we can fill. So there are multiple ways that aren't just the dollar resources, but that you can help. It's just that we want to be as safe as possible, and we want to make sure that we vet and that the organizations doing that create those safe environments. And if unable to do that, then what are those resources that can be done virtually? And that's where, where we can do supplies, we can collect things, we can educate folks on issues in the community around those areas. So I think those are ways that that we haven't thought about, that we're really exploring right now. But again, like one of the great examples, is that we have found ways to volunteer safely in some cases, but there are virtual ways that you can give back by supplies, ordering things like that, drop-off, pickup points, those kind of areas.
Eric, let me ask you the same question. Are there ways that people can help?
We've seen an incredible community response since the onset of this health crisis. One of the first ways was there was a massive amount of perishable food in the system that wasn't able to be utilized, and that got moved to our agency and other food pantries and food bank around the area. And so that was a huge immediate help. If you have a resource that you're not able to use that you think might do some good to some other folks, get in touch with one of the partners here today or somebody that you already have a pre-existing relationship with. The second area that I think is critically important is that there are folks who still don't know the resources that exist. If you have a friend or family member or colleague who's going through a crisis right now, don't let them suffer alone. Tell them where they can get help. Send them to the food bank and the food finder on their website. Send them to the United Way, send them to New Hope, send them to Hamilton Health or the other United Way partners. We have unused capacity right now to help with utilities, to help with job finding, to help with housing, to help with food. So don't be afraid that you're going to overwhelm our agencies. And I think the third and final area that, I think people could do some real good is employers. If you have a need for workers, if you would let United Way and our Road to Success program know, all of our programs are still operating in the background. We're trying to train people up for positions. We're trying to help people find work so that they can experience some economic success. It would be amazing to find out, here's where all the jobs are and where you could use some people in your companies right now. I know there's some folks who would really benefit from knowing those opportunities.
Let me ask our three other panelists, if I can get a yes/no answer. Need for volunteers, Jeannine?
Not on a day-to-day basis, but certainly we are starting to work with churches to be ambassadors in helping to educate the congregations, and the viewers can do this as well, about safe distancing, the social distancing, wearing the masks, getting ready for flu season and getting immunized. So it's really those ambassadors that can spread preventive messages. So we're always looking, we can train people to do that and give them the right information, and they can help to spread the word.
Joe, volunteers?
Yeah, we need volunteers every day. We have multiple sessions at our offsite packing center. Easiest way to get in contact is to go to our website, centralpafoodbank.org. Look for the volunteer feature, and you can sign up for hours and days.
I don't know whether schools can use volunteers or not, but maybe, I don't know, can you?
I don't think I've ever said this, but we're, in regards to supplies, we can, of course, always accept those, but we're not allowing extra people in the buildings at this time.
And we understand why.
Yes.
Here's a question from a viewer. What are the positive things you have learned about your organization during this pandemic? Joe, I'll start with you.
I've been amazed the way our staff and our volunteers have responded. if you touch food, if you move food, you're a driver, you're a warehouse worker, obviously you have to come to work and do that job. So we're doing it safely. We're following all the CDC and Pennsylvania Department of Health guidance. We're doing temperatures, masks, all those things we do. But I've been amazed at how well our team that is working remotely, folks that work in the office, folks that don't need to be touching food, they've been amazing. We haven't lost a single employee. In fact, we've added an overnight shift of warehouse folks to keep up with all of the demands. So I've just been pleasantly surprised that we put in place remote work and folks are using it wisely, and it's actually going to save us a lot of money next year because we don't have to lease any offsite space. So that's been a big positive for us.
Dayl, positive that you've seen with your organization?
Our leadership, our superintendent, superintendent has just really kept an open line of communication with us, because everything changes from day to day in the world of education. So he's trying to keep us well informed, and the leadership team is just working so well together in order to do what's best for our students and also our staff. Our staff, as we communicate information to our staff, they are so positive. And again, they want to teach our kids. Like, they want to get into our buildings. So, they're just kind of gung-ho and like, whatever I can do, just let me know and we'll be there for you.
Jeannine, I'll ask you, and then we have to go on to our final question, but the positive things that you've seen of your organization.
Well, I have to say that we are truly blessed to have the awesome team that we have at Hamilton. As I indicated, we've been open since the very beginning of COVID. It's been a very challenging time for all organizations, but particularly in the healthcare environment. We've had to adapt to all the changes that have been needed. The staff has remained dedicated, serving the community. 95% of our population that we serve are below the federal poverty level. And so they have tremendous needs, and the staff work collectively, helping to coordinate care, making those linkages for the most neediest of patients, neediest of citizens that we have. So we are very blessed to have that group of people working at Hamilton, both from the doctors, dentists, all the way to our frontline staff.
It's time now for our final question, and my final question is probably the one on most people's minds. And Tim, I'll direct this one to you. Funds are tight for many people. Why is a gift to United Way so important this year? Tim, I'm going to let you answer that one. Basic question is, why United Way?
Yeah, I think I look to my right, and which is, I guess, maybe your left, and this is the reason why that this collective model, that these issues, that families aren't dealing with a single issue. They are dealing with multiple issues, and they're very complex. And the ability for us to bring to the table incredible partners, like you've heard from today, that really help in their distinct areas, and then when you bring them together, it's a total solution to really move people that have been affected by the pandemic, had been affected in their lives, to move them ultimately to self-sufficiency. Our goal is so that people will not need supports in the future, that they do not need subsidies. And it really takes the ability of health, of a great education, of somebody's basic needs being met, and then ultimately getting that support, and when they get that job, to be able to be self-sufficient. And it takes all of these elements coming together. When you give to United Way, and it doesn't matter if it's $2, if it's $100, $1,000, or $10,000, we collectively pool these dollars together that enable us to do so much more, and that enable us to really leverage your giving to be able to solve these very complex issues. And it's very unique in the way we go about doing this work. And the money stays local. You know, this is not money that gets sent off across the nation or across the world. These are local, and we help the people right here in our community. So when you talk about United Way, when you see the campaign, when you see the commercials, the ads, this is local, this is right here, and this is a great example of how it makes a difference in education and access to health and food and basic needs being met and helping people get jobs. So this is really why United Way becomes so unique in this way, is that we work at these very complex issues, but our ultimate path is to help somebody so they don't need help in the future. And that's really the work that we do. So when times are tight, you know, we want there to be those safety net supports, and we want you to support those organizations that are near and dear to your heart. But at the same time, we want to make sure that we solve these very complex issues, and we ultimately help people succeed in their lives so they don't need that help in the future.
If any of our panelists would like to weigh in on why United Way, feel free.
Scott, I'll take
Go
you
ahead,
up
Joe.
on that. It's really important for us to remember that even in this crisis, we have folks that are still getting paychecks, they're still working. They're blessed as we are blessed. I receive a paycheck, I'm blessed. And also there are folks that have the capacity to give, and that's who we're asking to give, folks that have the capacity to give. We're not asking folks who really are struggling, you know, please keep your resources, we're here to help you. But if you have the means to give to United Way and support missions like ours and the other folks represented here.
All right, so we've come to the end of Champion Summit, but Tim, stuff the bus. What is stuff the bus?
Thank you. So we talk about other ways to give back, and you kind of teed it up before, Scott. So we have this incredible opportunity. Many folks are aware of the Day of Caring. It's a United Way staple for multiple years in which we bring thousands of volunteers together that swing hammers, paint fences, and do work. As you can imagine in COVID-19, and to keep folks safe, we aren't able to do that. However, a genius team came together to really say, how can we help during this time in a safe way to do this? And the Stuff the Bus idea, this Days of Caring, this is the official launch of that. We want to help and make sure kids are ready for school. And not just ready for school supplies, because they're still going to need them. And when they're ready, and the schools are limited on their supplies and what they can offer with their budgets, but also in safety items too. So we talk about connectivity, safety areas to help make sure that schools have the supplies they need for the teachers to be safe. So you have an incredible opportunity to really, over the next time up till September 11th, and which is the final kind of accumulation of this day, is we're asking for your help to get our kids ready for school in the community. And we work with 10 school districts in the community to do this, and they're willing and they're helping, and we want to stuff busfuls of supplies to help the schools and make sure that those kids in need and those families in need and the educators are prepared and have the tools necessary to make sure they have a successful year. So we are officially launching this today, and we have an incredible partner with our friends at Highmark. Highmark has allowed us to do this through their support. They see the value of school readiness, of kids being ready for school, along with health issues and those basic needs areas. And this is an incredible opportunity we have with their support. We're going to have 3 locations on September 11th to drop off materials. And you say, well, Tim, I can't get out. I'm concerned about that. Well, we're setting stuff up on Amazon in which you just kind of like those wish lists that your kids have given you or friends that you can get all the gifts for them. We're going to have ways that you can actually order supplies on Amazon. They get delivered to United Way, and we make sure to get to the schools in need at this time. So we're really excited about kind of as we pivot during these unique times to do this, but this is really the kickoff of our Days of Caring and a way for you to be able to get back. So as you just received an invitation to this event, we're going to be sending out information to all of you on how your companies, how you individually can participate and support this effort. But our goal is to really make sure our kids are truly, truly ready for school this year in this unique situation, and we're asking for your help to do that.
So, Tim, what kind of contributions do you think that should stuff the bus?
Yeah, that's a great. We have a long list, so you can really choose on this list. But it is the traditional items, pencil, paper, things like that. But we're also talking about masks and these hard-to-find hand sanitizers that you see right here, and those areas that help those teachers and create that safe situation. So we have an incredible list that we can pull together. So if it's health areas you want to be interested in, if it's actual school supplies, so it really is a list, and every little bit helps. helps. If you say, Tim, I can't do much, if we can just do, 100 pencils to somebody or 25 or a group of Post-its, I mean, these are things that all the teachers can use. So at any level, we can really look for this support to be able to do that. And you can do it from the safety of your home, or if you have the ability to do a collection at the office or a drop-off point and drop it off, we have that, and we make it as easy for you as possible to do that.
Dayl, as an educator, I mean, you just heard what Tim said, but in the classroom, what do classes need the most?
The regular supplies, of course, and then those cleaning supplies. Some districts are in a position where they can provide the cleaner, and they're going to do that. But then, we're like our district is providing right now one thing of hand sanitizer, but then we're going to refill them every day. But we could use more than the one, and we're thankful for the one. But so hand sanitizers would be great, cleaning supplies, and maybe some chocolate. No, chocolate for our teachers.
What about apples?
Yeah. Oh, I forgot apples.
Hey, I want to thank our panel members and viewers for joining us for today's Champions Summit. Have a great day.